Consumers have strengthened and influenced our research programs by informing us on outcome choice, on consent process, on study design, on methodology, and really have had a critical role in all aspects of our study design. So our approach to consumer and community involvement has been to set up a consumer committee which informs our whole research centre's work. And this really came about because within my own work from a nutrition perspective, I recognised as a researcher I wasn't doing this very well. And so I started to investigate it from my own perspective for my own program. And then looking more broadly at our research centre across all programs, I realised that the involvement piece was being done well with some programs and not at all by others. And so that set us on a task to really set up a committee that informs all of our program's work and a register of consumers who might wish to be involved in any aspect of our research. So we set about this and looked at various frameworks and models that were available. And to be honest, this was quite overwhelming. I was very new in the space and it was a lot to look at all of the various models that are available. And eventually we just looked and settled on something that we thought was relatively simple, was clear and would suit our needs. And so we used guidance from the Victorian Comprehensive Cancer Centre and also Safer Care Victoria. And we've taken elements of those two things and put them into our own documents to inform our process.
The best part to be a health consumer in research for me is I could challenge the researchers to see outside the box. And also at the same time, I was able as a health consumer to ask the question. The question perhaps is very normal, ordinary to any other people, but for the researchers is opening the different angle to look at the consumer's perspective in order to enhancing their research. Most helpful points for me, if I can summarize it, was connection, communication, and support. By all these points, I mean providing the opportunity and platform for the consumer to be able meaningfully to engage with the researchers for better and positive outcome for everyone.
Speaking to our consumers and hearing their stories and allowing them to contribute to our ideas and be involved in our whole process reminds me that really they are why we're here doing this. This is why we're trying to improve healthcare and make better outcomes. And so that has been a really nice reflection just to get back to basics and remember that the end user or the consumer is why we're here to do this.